Hi everyone. We will get started about 1 minute past 12. We'll just let everybody join for the moment. Good afternoon, everybody. We're just going to wait a couple more minutes for people to join and then we'll get started. So, good afternoon, everyone, and thank you so much for joining us. I'm Rachel Joy, I'm SheMed's Chief Clinical Officer, and today I'm going to talk to you about the new Wegovy 7.2 dose that has become recently available on the UK market. Our goal of the session today is to help you understand a little bit more about Wegovy 7.2 milligrams, and also who we would recommend it for and what things you should be considering. We're really aiming to answer the majority of the questions that we've had submitted. So thank you so much for providing those before today's session. Let's kick off. What is Wegovy 7.2 milligrams? So before we get there, I think let's just take one step back. So Wegovy is a medication that contains semaglutide. It was first licensed in the UK for weight management in 2023. Now, semaglutide itself wasn't actually new at this point. It had already been used for several years, but under the license name of Ozempic, and it was for that treatment of type 2 diabetes. One of the things that people noticed, or clinicians noticed really, was that early on was that people were actually losing weight when they're on Ozempic. So this led to the manufacturer, which is Novo Nordisk, to run some dedicated clinical trials, and they looked at semaglutide for weight management. But what they did do is they did it at higher doses, so initially looking up to 2.4 milligrams than what was initially used for Ozempic, which was 1 milligram. On the back of that evidence, Wegovy actually became the first licensed GLP-1 medication in the UK market for weight management. And that was when we've seen over the last couple of years of the use of Wegovy 2.4 milligrams. So now why is there Wegovy 7.2 milligrams? So if we go to the next slide, Wegovy doses, like we said, have always been available up to 2.4 and now have been available over that dose. What we started to see both in real world practice and the original clinical trials was that while many people did very well on 2.4 milligrams, not everyone reached their individual health goals that they were aiming for at that dose. In those initial trials, so in the Step Up 1 trial, we looked at people living with obesity or overweight, and there was a clear group of individuals who responded really well. And there were others that didn't respond overly well to those initial doses and maybe could have looked at having a higher dose. Because of that, Novo Nordisk carried out some further modelling and some additional work, which looked at Wegovy and how our body behaves to higher doses. And what it suggested is that a dose higher than 2.4 milligrams could potentially lead to additional weight loss and other health benefits, and actually without compromising safety, which was really important. So off the back of that, Novo Nordisk launched a step-up trial. This was over the past kind of year, and they've looked at higher doses of 7.2 milligrams of Wegovy. They did look at several different things during these trials. So they looked at safety to ensure that it was safe for us to take higher doses. They looked at tolerability, really looking and focusing on side effect profile to make sure people could actually tolerate those higher doses. Looked at the outcome, predominantly looking at weight loss. And another thing they looked at was waist circumference, really focusing on central fat and the metabolic risk that's associated with it. And what the results actually showed is that for some individuals, not everybody, but for some, 7.2 milligrams of Wegovy actually did provide that additional benefit compared to those lower doses. And that, in fact, it could be used safely and effectively when prescribed and used appropriately to gain different results. So increase your weight loss, reduce down the waist circumference, and actually were well tolerated. So based on all of these results, Novo Nordisk applied for this higher strength to be licensed in the UK. And that approval was granted very recently, which now means that 7.2 milligrams can be prescribed for individuals who are likely to benefit from that higher dose. It's really important that this is prescribed and it is under clinical supervision that is recommended that you go up to those higher doses. So now we're going to look at who is suitable to be titrated up to Wegovy 7.2. I think it's really important to say up front that Wegovy 7.2 milligrams is not suitable for everybody. If you're starting Wegovy, nothing changes in the terms of how we begin your treatment and what that schedule would be. And we really follow the same titration principles that we always have. So you want to start on Wegovy, everyone will start at 0.25 milligrams once a week for at least 4 weeks. After that, a clinician will review how you're doing. So we're looking at your weight loss, how well you've tolerated that medication, so thinking about those side effects. And then it's decided whether stepping up to that next dose is right for you. One, is there a requirement? And two, can you tolerate it? If that is right for you, you would then be stepped up to that 0.5 milligrams. And I think one thing important to say is that as a team here, what we're generally aiming for is people to lose between 0.5 to 1 kilos of weight loss per week. If weight loss is slower than that and you're tolerating medication well, meaning that you aren't experiencing any side effects, then it may be worth considering increasing that dose, and our clinical team will do that. That process really does continue, and it's very gradual, and it can continue in that way, potentially going all the way up to 7.2 milligrams, but only if it's appropriate and only if it's clinically prescribed for you. What's really, I guess, important to understand is that as clinicians, we always take a holistic view. And sometimes weight loss does plateau for a few weeks. Someone might be experiencing some side effects. And in that situation, it might be that we actually recommend that you stay on your current dose for an additional 4 weeks, even if you have plateaued in that weight loss, but it allows your body time to adjust to the medication before we increase that dose again. This approach really is about reducing your risk of side effects that can become difficult to tolerate. And really, we want to set you up in the long term for success. Remembering that principle that this is a marathon, it isn't a race. And just being really considerate of yourself and your body and the changes that it's adapting to during this period. So I guess to summarize, the decisions about moving up in the dose are always individual and they're personalized to you. And we base them on 3 main things. So weight loss, are you achieving that 0.5 to 1 kilo weight loss per week? Tolerability, how are the side effects? Are they manageable? Are they minimal? Are they too big to manage? And affordability, our dose increases sometimes do come with cost change, and it's important that it is affordable and the price point works for you as well. And just say all of this is review and decisions are made with your preference in mind, but they are made by a clinician. So the next question that we've got is, if I'm on Wegovy, will I definitely need to be titrated up to 7.2 milligrams? I mean, the simple answer here is no. We've kind of just talked about what our titration schedule is and what we think about. And the goal of treatment isn't to reach the highest dose. it's really important that we remember that it's about finding the lowest effective dose that supports your health goals, your weight loss that you're trying to achieve, whilst also ensuring that the side effects are manageable and you're feeling fit and well. So it really does depend on each individual. We all respond to medication differently. If your weight loss has plateaued on 2.4 milligrams and you're tolerating side effects well, then yes, the clinician may decide that an increased dose is right for you. However, it is important to remember that not everyone would get it titrated up to that top dose because simply you may not need it. The next question is, how much weight loss can I expect on Wegovy 7.2? And I guess this is quite a common question at the moment. And the honest answer is, like we just said, it really varies from person to person. But we do have trial data that can kind of help set expectations and what we will be thinking about. So in the Step Up trials, when we looked at this 7.2 milligrams, it followed people through their weight loss journey and through their Wegovy program. Over a 72-week period. And the results were really encouraging around the weight loss that people saw. So nearly half of the participants taking 7.2 milligrams achieved a 20% or greater reduction in their weight. And then actually almost a third achieved more than 25% or more. So these are really significant results and are definitely at the higher end of what we've seen with GLP-1 medications. If we look at the GLP-1 treatments that are available currently in the market, this means that the weight loss really achieved between doses of Wegovy now at this higher dose are really comparable to the doses or the weight loss, that we've seen with Mounjaro, which I guess is often been referred to as this King Kong of GLP-1 medication. I think it is important to say, though, that no dose guarantees any particular outcome. And the numbers that I've just shared are all based on the clinical trial averages. And your individual results really do depend on things like how your body responds, how long you're on treatment, what side effects you are, what titration schedule you're following, and also what your desired outcomes are. We already mentioned this, but the goal with 7.2 milligrams is really not to get everyone to that higher dose. It's actually to give us another option for people who are tolerating treatment but need a bit of additional support to reach those health goals and potentially take them on that next kind of weight loss journey. So remember, it's about finding the right level of support for long-term sustainable weights, not short-term weight loss. I guess the next question really commonly asked is, will I experience more side effects if I'm taking more of the medication? One of the principles to remember here is that generally most people experience those side effects much earlier on in their GLP-1 journey. This is when the body is first adapting to that medication. So the majority of people who do experience side effects would be at that earlier stages, and they are mild and temporary. If we do look at 7.2 in particular and focus on the Step Up trial and what was spoken about and learned around side effects, what we did see is that more people did experience those gastrointestinal side effects. So thinking about nausea, bloating, and constipation and heartburn, but they were all pretty short-lived, mild and really well managed with over-counter medication. There were a very small number of reports of this sporadic kind of neurological symptom. People have described that as burning, itching, and electric shock kind of sensation, which people did experience in skin, mouth, or the scalp. But what I would say is these were very, very uncommon. And in most cases, they all resolved on their own, why people did actually continue on the medication rather than having to stop them. So very infrequent and very well managed. I think the key thing here to remember is the most common side effects do remain those kind of gastro side effects that we spoke about. And there are some really simple measures that you can do that can make a big difference. So thinking about those principles of staying well hydrated, eating smaller balanced meals, prioritizing sleep. And also we provided you all with a side effect care kit. So thinking about just using some over-counter treatments that may support you. And also, I think just importantly say, this is exactly why us at SheMed use that slower titration and we do those regular reviews. We want to ensure that you feel fit and healthy. If the side effects are troublesome, that you know what to do and what dose should be the correct dose for you to be on. So while those higher doses could come with a higher chance of side effects, Most are manageable, they're really temporary, and something that we can definitely support you through our kind of side effect care package or getting some advice using the app as well. So then we're going to talk about a bit more practical things about how do I take the Wegovy 7.2 milligrams. So I put a display here of a leaflet that you would be getting if you've been prescribed these doses. They will be going into any medications that we send out from this week onwards. So the 7.2 milligrams is still taken once a week, and it's important that you do that, and it's taken on the same day each week. That part is a really clear principle that we do not change. There is one thing that is changing with the current 7.2 milligrams, and that is the number of injections that you actually need to give yourself on that day. So when you receive your first 7.2 milligram prescription and medication, you'll see that it is supplied as 3 2.4 milligram pens, which together cover you 4 weeks of treatment. So to administer the 7.2 milligram dose, what you need to do is give yourself 3 separate 2.4 milligram injections, all in one session, all on the same day. It's important that when you do this, you have read and you follow that patient information leaflet. There's nothing new in the terms of technique. I guess I can just give you a few practical points to think about. So make sure you change the needle in between the injection. You don't want a blunt needle that you're injecting with, that will get more an increase in pain. Make sure you reset the pen dose each time to make sure you are delivering that full 2.4 milligram. And really, you can inject it into that same body area. So thinking about the abdomen, the thigh, or your upper arms, just make sure you do space each injection at least 5 centimeters apart. And as always, if there is anything that you feel is unclear or you are unsure on the day, then you can reach out to our support team who'll be really happy to help you. So if we just move on to the next slide, and I guess this is really just to reiterate that, yes, it is a prescription medication and you do need to take all injections in the same session. So it's 3 2.4 milligram injections that you are taking at the same time. So I guess there is a question here is why isn't 7.2 milligram available as a single pen and as one injection? At the moment, the auto-injector pen simply just can't hold enough liquid to deliver that full 7.2 dose in one injection. That is the limitation of the current pen design rather than the medication itself. So Novo Nordisk already is in the process of licensing a new auto-injection pen, and that will be able to deliver that full 7.2 milligram dose in one single injection. We are hopeful that we'll be able to get this around the middle of the year. But until then, the approved and safe way to take the 7.2 is by giving yourself multiple injections in that one session, as we've spoken through. I understand that this can seem a little bit daunting at first, but hopefully the process is quite straightforward. And by this point in your journey, you should be quite used to giving yourself that weekly injection. But like we said, if you have any questions or concerns, then please do reach out to us. And we have popped that leaflet into the boxes so that you do have that guidance there for you. So next question, can I switch to Wegovy 7.2 milligrams from a higher dose of Mounjaro? So the answer is no, you cannot directly switch from a higher dose of Mounjaro to Wegovy. You do need to start back at that lowest dose of 2.5 milligrams of Mounjaro and then titrate up in accordance to your response in medication. It's the same process that we always use. And the SheMed clinical team will be really happy to support you on this transition and dosing if this is what you decide to try. So I guess everyone wants to know, how do they request it? If you feel that you are in someone who should be considered for a 7.2 milligrams. So when you're next due your refill, and if you're currently taking 2.4 milligrams of Wegovy, we will ask you how you're feeling about your weight loss. If your weight loss has plateaued or you have concerns, you'll be given the option to indicate whether you'd like to be considered to a dose increase, and you'll be shown the associated costs with this. So at that point, you'll be given that option if you would like to be considered or not. From there, our clinical team will complete a full review of your records. So they're going to look at your weight loss journey. They're looking how your body has responded so far, if you experience any side effects currently. And really based on that holistic review, the clinician will decide whether increasing your dose is clinically appropriate for you or if remaining on the current dose that you're on is the best option. So any decision to change the dose is made with your safety, your tolerability, and long-term success in mind. And we do take into consideration your preference here as well. So I've got two other just slides just around kind of what do I expect when I reach my health goals? So this is not necessarily about 7.2, but what actually happens. So first of all, I think to say that reaching this point is really a big deal. It's something to be super proud of. And it's also important to know that it isn't the finish line. Everything doesn't suddenly stop at this stage. Weight regulation, metabolic health are long-term chronic conditions. So in that way, this isn't different from managing things like your blood pressure or your cholesterol. And ongoing support is what really matters. So when you reach your goals, our focus kind of shifts. So we're no longer concentrating on driving weight loss. We're looking at something more maintenance. That means working with you to find the lowest possible dose that helps you maintain the results and your desired health goals, and also make sure you feel well. Yeah, so for some people, this might mean completely slowing and stepping down those doses over time, and you may get down to that lowest dose. For others, this could be staying on the same dose that you're currently on. There is no right or wrong answer here. It's about how your body responds, what your health goals are, and what works for you long term. And then finally, I thought I would just take the chance and opportunity just to give you a bit of an update on our initial study data. So as a lot of you hopefully are aware, is we launched with a study when SheMed first came to market. And what I wanted to tell you all is that it's really exciting that we're currently in the final stages of pulling together our first paper. This is looking at the initial 6 months results from our study cohort, and this is in collaboration with University College London. So the data that we have is really focused on real world outcomes. It's not just about weight loss. It's about the broader health around quality of life and how people have actually experienced GLP-1 treatment over time and the SheMed program. At the moment, we're just checking off all the data, ensuring everything is correct. But we will be able to very shortly share all these insights with our SheMed community, and also importantly, contribute to the wider evidence base that is out there on GLP-1. So really watch this space, and we will communicate with you as soon as we have those results available, and we'll share it with everybody. So finally, thank you everyone for joining us today, and hopefully you've understood a little bit more about Wegovy 7.2 milligrams. The webinar will be uploaded onto the Discovery tab, so you will be able to watch it back at your own need. Thank you everyone. Bye-bye.